Across public hospitals in Nigeria, activities have slowed to a crawl. Consulting rooms are empty and many patients are left unattended as resident doctors down tools nationwide. The Nigerian Association of Resident Doctors (NARD) says the decision to begin the indefinite strike was not taken lightly. The body accuses the federal government of failing to implement key agreements reached after previous negotiations and the expiration of a 30-day ultimatum.
So in 2009 and 2014, there's a collective bargaining agreement between doctors in this country and the federal government that whenever you adjust minimum wage, naturally the basic salary is affected. But also the allowances should also reflect that new minimum wage. Unfortunately, in Nigeria, in the last 10, 15 years, anytime minimum wages are adjusted, it only affects the basic salary. We've been agitating. Sometimes early this year, that agitation led to, okay, let's sit down and look at what can be done about it. We sat down, tables were proposed, conversations happened. Government went behind us to release a table that they did not discuss with us, with probably a 1.7% adjustment that eroded the relativity.
The Association of Resident Doctors have every right to go on strike, to block their services, because that is the only recourse, and that is the only thing that government hears in Nigeria. So we can only advise government to be faithful to agreements, to ensure that they go back and implement what was agreed.
Among their demands are a 200% increase in the consolidated medical salary structure, full payment of outstanding allowances approved since July 2022, and the immediate recruitment of new clinical staff to replace those who have left the system. The association insists the strike is not politically motivated, but a collective call for the government to prioritize healthcare and the welfare of medical professionals.
We have one particular challenge now in this country. That is excess workload, burnout from doctors. The population of Nigeria has exploded. Public health models suggest we are closer to 280 million than the 220 that everybody is throwing around, which means the number of patients you see has almost doubled. Then the number of doctors that see those patients has reduced by more than half. Then inflation, exchange rate, economic realities has slashed down salaries.
They are human beings and they are working. If you owe somebody, remember, government was starting at a point, no work, no pay. And you remember we said no pay, no work. You are owing them. So if you are owing them, how do you expect them to work? If you had agreement with them and you reneged, how do you expect them to continue working? So it is the irresponsibility of government. It is the refusal of government to be responsive to the dictates of governance by at least ensuring that situations that were negotiated and agreed through social dialogue, at least the government implements them.
Health observers warn that the impact could be severe as resident doctors make up the majority of Nigeria's hospital workforce, providing critical service in surgery, emergency care, and specialist clinics. Nigeria's health sector has a long history of strike, including major doctor walkouts in 1981, 2014, 2020, and a 2-month NARD strike in 2021 that crippled hospitals nationwide.
If you don't pay a worker, how will he come to work? How will he feed himself? How will he clothe himself? Pay him arrears of something billion and you have not paid. It's a terrible thing. And we're talking about it in Nigeria. We're talking about what is the NARD doing. We should ask government, why have you refused to pay? And have you refused to pay them the money? Workers have worked. It's earned income. Remember, that is what we're talking. We're not talking about charity. We're talking about an income that has been earned, that has been worked for, and you refuse to pay. So if you refuse to pay, what should we tell you? We should tell you, please, go and pay.
The strike deepens long-standing disputes with government, leaving hospitals barely functional and forcing Nigerians to seek costly private care as doctors insist they will return only when demands are met. Sydney Okafor for Anchor News.